Legislative assistant.
Yep. Jared, can you hear us?
Yes, I can hear y'all now.
Okay, perfect.
Yeah, Representative Fischer is just running a few minutes late today, but he will be in shortly.
Okay, thank you.
Yeah, of course.
That's always running. So Jared's last name is nothing, or we don't have to know. Oh, Margolis. Okay, right. Right. I talked to him.
The association we had for characters trained us, like a Slavics, where to stand to catch them.
They're hanging out in the hall.
Going
Getting a drink, whatever. Just to bend their ear for 2 seconds.
eating as long as I talked to him, but he listened.
Oh my
He heard me.
gosh.
Goodness.
Wasn't it?
Come to think of it, that was a oh, yeah.
Goodness.
Committee that he's now vice chair for.
Yeah.
What happened there?
Yeah, he's the chair of the Human Services Policy Committee.
Them two.
Speaker should face forward. Speaking to 6 inches.
They have that.
44A is a district that's in the city somewhere. 44A.
Is what Doc Ann said.
Maplewood?
Maplewood.
Oh, well, some poverty in that area.
Morning. Can you folks hear me?
Yes, good morning.
Good morning.
Awesome.
Well,
Good
thank
morning.
you.
How are you folks today?
Great. Thank you for your time today, Representative Fischer. We are a group of folks from New Ulm, Minnesota. My name is Wendy Broderson. I'm the Fund Development Director for Oak Hills Living Center. And we are a 94-bed skilled nursing facility, standalone nonprofit. So we are highly concerned about House File 733, among other issues in the skilled nursing facility world, and hoping that you'll have some positive input for us on the outcome of that bill.
Okay, and was that and I'm sorry, I'm working off the top of my head again. The what was the file number again?
733.
733.
Yep.
Was that Representative Edelson? Was she the chair? Was she the author of that?
The author on the Senate side I know is Hoffman and Abler. I'm not sure who is on the House side of that bill. Do you have that, Candace?
I have Housechild and Farnsworth.
Housechild and Farnsworth?
And Cooper.
Does not sound.
That's the Senate.
That's the Senate file?
No, because the senators are Hoffman and Abler.
Yes.
Right.
Right.
That's for the Senate side, 780. We are concerned about wages for caregivers in skilled nursing facilities. If we do not pass that bill, which would add $1 billion to fund skilled nursing facilities and long-term care wages, our ability to continue operations will be very difficult. And that is the case for many skilled nursing facilities in Minnesota. We understand that as of right now, skilled nursing funding is not in Governor Walz's budget, nor is it in the budget that's coming out of the House. And we are here to care for people, so we need to make sure that our facility continues to exist and operate positively.
All right. Couple of questions that I have, because I was also at the same time here trying to, because I've heard many bills in the long-term care continuum, and so I'm just trying to make sure that I'm tracking the right ones.
There are two that pertain to us. One is House File 733. The other one is House File 908. House File 908 is not a bill that we would like to see pass. That would establish a nursing home regulations board, workforce regulations board, which would add additional regulations without funding to our operations. And we do not want that one to proceed.
Okay, the 733. Okay, the 733 is the Edelson one. So, and I apologize here as I'm bouncing back and forth because I just want to make sure I had the right ones. Is yes, I know the Edelson one came through. I know that Chair Noor had laid it over. I know that what he was mentioning, he rolled out his bill yesterday that had all of the funding of the long-term continuum in there. And I talked to him about it quite a bit. One of the things I picked up from him is that while he did not have any particular money set aside right now in the nursing one, he had told me that the reason he had not is that there are already scheduled increases that are going to cost $800 million that are already scheduled in the package that has already been approved out there. This is something that's automatically built in. He was trying to focus on the other areas that have not had raises for quite a while, where a number of the people were still making only $13.48 an hour. And what he wanted to do is he wanted to get everybody, including in the nursing home range, up to an average of between $20 to $23 an hour. The frustration that came out is that his budget target did not allow him to do that. Most places, when he's talking about personal care attendants, where a lot of them are down in the $13, $14 range hour. There's over 52,000 openings right now. So what he was trying to do is where we had some money is also trying to get money to make sure that we weren't leaving any parts of the long-term care continuum, the assisted living continuum, the disability services, that whole area, he was making sure that none of them were being left behind and trying to get them all up to a comparable level. And so that's where most of his dollars went that he had in that area. I do know he's still looking at that going forward. There's also another part of the problem that we have is that we know that everybody doing this has to be paid a living wage, and we have to pay and we have to provide the reimbursements to the people like in your situation to make sure that they can afford to do that. We know that when we do that, we still have 140,000 more job openings than we have people. And this is one of the problems that we're running into out there. Is one of the provisions he added in his bill was a provision and some limited funding to bring in new people into our state that they would be rapidly training to help fill the jobs out there. Because I'm hearing this is the problem that you're running into. I'm hearing it from every industry, and very concerning is also from the local fire departments in my area, where they're having such a hard time filling positions. They are making people work 5 24-hour shifts in a row with 1 or 2 days off, and then another 5 24-hour shifts in a row because they don't have enough people to fill the jobs.
So we understand that the labor crisis is industry-wide. We care for people who can't care for themselves. We are the last place people have to go when they run out of money and they can't care for themselves. They can't get themselves to the toilet. They can't dress themselves. And we need to keep skilled nursing facilities here. It's not the same as home health care, and it certainly is not the same as assisted living. When people age out of assisted living, they come to skilled nursing homes. So we need to fund them. We need to fund them fairly, and we need to make sure they're represented.
I hear that part, and I also know in the personal care area that we've had people who've testified in our committee that people have died for not receiving personal care assistance in their own homes. So it's not just a nursing home, it's a serious problem across the entire long-term care continuum that we need to address in a holistic approach and make sure that we're not leaving anyone behind that is vulnerable in these areas.
Right, but that means that we have to put the money to it. Like the whole $1 billion for everyone, and not just fund PCAs or not just fund assisted livings.
No, we're not just funding one or the other. As I said, besides what we have already that is in the bill right now, there's already another $800 million that is going to the nursing homes that we don't have to approve. It is already there, but has not been sent out because they are automatic increases that we'll already be having that we don't have to act on.
That's news to us.
And this is what I was told by Chair Knorr. And so I'm going by what Chair Knorr communicated to me when I raised this particular issue on nursing homes to him. And that was before he introduced his bill, because I said, I'm very concerned about what's happening. Do we have dollars that are already going in? Are there raises? Because I told him I don't want any sector left behind. And he said that what he was coming out with would make sure that no sector was left behind and that there were already things being done in this area. And what I just mentioned to you is what he mentioned to me.
That's interesting. We understand there's a rally tomorrow because long-term care is not being represented in the House budget. So this is different information than we've been hearing from Representative Torkelson and Representative Zelinsakar that we spoke with yesterday. So that information is certainly not consistent.
No, and I appreciate you raising that to me, because then what I'm going to be doing is after this, I will be seeing Chair Knorr within the next couple of hours, and I will be bringing this point directly back to him, saying that what I'm going to tell him is I'm going to tell him what you told me is not what it was what's coming back. I'm telling him there's a disconnect out here, and we need something to make sure that this is clarified. Because if that's not the case, if that 800 million is not going out there, then things need to be addressed. And that's right. So what I will say from my side, that is what I'm going to be doing.
Well, we very much appreciate that clarification.
So, and I appreciate you raising that point to me and challenging me on it.
Thank you very much.
You're welcome.
I want to mention that I've tried to get a hold of Representative Knorr many times, and I've gotten no response, which makes me all of a sudden try to figure out why that's the case. So I'm glad at least that we're speaking with you. My name is Ann Bogle. I'm a physician, family medicine in New Ulm, and I actually had been involved as a medical director, and I've watched nursing homes since the 1970s evolve. And that draconian kind of policy that says, we have this, can't have this differential in private pay versus Medicaid patients has just sunk us. I mean, we've been torpedoed. And I have been working now on the operating board of this nursing home locally in New Ulm and had patients in several skilled nursing homes in Brown County, which is south central Minnesota. And they are having the same kinds of problems. And they're on the brink of closure if they don't get money immediately. I can't imagine, as a physician, that we would have people in our rural access hospitals, which is just less than 4 blocks from where this home is, and they have people ready for discharge, they're on Medicare, and they say, okay, we're not going to reimburse you because you can't get your patients out to a skilled nursing home. This would be a disaster. And we live in greater Minnesota, and if they can't come locally, they may end up, I can't even think about it, in Iowa, South Dakota, Wisconsin, and then emotionally they will be completely disconnected from their families, which is a living hell for some. And I understand that, and I can't even imagine that this would evolve. And I know that people that are in the legislature certainly have hearts and minds and souls that want to address this, but we have to have them understand it. It's different, I think, than what you may be exposed to in the metropolitan area. That's my assumption, but I don't get it, why it's not even on the agenda.
And in terms of the metropolitan area, it is also a problem with the nursing homes in this area here. And also one of the things that I will say is that I also recognize that, as I said earlier, it's not only an issue of making sure that we have the dollars increased out there, but we have to find a new pipeline of people to start coming into the state to start doing these positions. And that's one of the things that we do have in our bill is dollars that will bring people in dedicated to help fill the long-term care position openings that are out there. Because as I was mentioned before, we have 140,000 more jobs that are open in this state than we have people available to fill them. And the biggest area where we've got the vacancies are in the long-term care continuum. When I say long-term care, it's from personal care attendants all the way up through the nursing home facilities, up and down the chain. And that's where the largest number are. And so we're trying to find a new pipeline of people, because even as we raise dollars, we're still going to have vacancies out there. We've got to get those filled. So we know that we want to make sure that people don't fail financially, and at the same time that we've got bodies that go with it. It's it's not one or the other, it's both. We need both components. And that's one of the things that we're also working on to make sure that we fill this other component.
Does that plan include immigration reform?
Immigration reform, as much as we're allowed to in the state. One of the things that we do provide for is the flexibility is that we would provide dollars to the legal aid societies and to attorneys to give them the tools that they need, the resources they need to expedite people through the asylum process that is out there. From my understanding, there are many more people who are qualified for asylum. Once they apply for asylum, they could get up to a 5-year work permit that they would be able to get. These are one of the areas that I've been working with a team of 20 different organizations, putting together funding and language so we can make this happen. And this is something I've been working on since I first heard the Edelson bill. And I'd say this is probably about 2 months ago now that I've been personally advancing between the different organizations, not only in terms of nonprofits, but also in the government world with the Department of Human Services and also with Chair Knorr to make sure. And as a matter of fact, he's got that language in his bill that he just came out with.
Well, we appreciate your insight that the issue is bigger than money. It is a broken system that needs to be fixed. So we appreciate that.
And that's why I've been so invested, because I see the issues and want to make sure that we're approaching it from a holistic situation, because as more people come in, that can also help take some of the pressures off on the rapid inflation that we are seeing in wages out there. That helps buy a little bit in that space. We still want everyone to be paid a living wage, and at the same time, make sure we've got the bodies that are coming in to fill these positions as these wage increases come through.
Representative Fischer, we have 2 students here, actually. They come from our high schools, and I thought maybe they could just make a comment, because that's part of our future workforce. And we have one that's on, and I'm going to ask Joey Cotton to just make a brief statement of where you are in high school and what you're doing at a nursing home right now.
Hello, my name is Joey Cotton. I'm a junior at New Ulm High School. I work at Oak Hills Living Center, and I love my job. I love working with residents. They're really nice to me. Um, these men and women cannot care for themselves, and it brings me joy helping them. It scares me if they didn't have anyone to help them. It's a scary thought to think about. They need help. If there wasn't a nursing home in the area, I don't know what they do. So.
And the other student can introduce herself, and she comes from one of the other high schools in town.
I am Dorothea Grubbs. I'm a senior at the private high school right outside New Ulm. I've been working in worked at a skilled senior facility. It's not nursing, in New Ulm called Woodstone Senior Living. And then I also work at Oak Hills, which is a skilled nursing facility. I've worked for about 2 years, and I do have my CNA. I've had it for a couple months now, and it's
Congratulations.
thank you.
You're
I
welcome.
it's these people can't care for themselves, and not only can they not care for themselves, the people that love them also can't care for them, whether that's spouses or children, or sometimes in younger resident cases, their parents are alive and are also in nursing facilities. And to be able to feel like you can't care for the people you love and there's not a place for those people to be cared for is devastating. So, without funding, these people are not only are our residents going to be devastated, their families are going to be heartbroken. So it's really important. We need money, and it needs to come now.
Okay. Well, thank you, Dorothy and Joey, for sharing, and thank you both for doing this work. It's great to see your interest and your care for people in these areas.
Representative Fischer, my name is Mike Firth. I sit on the foundation board for Oak Hills, and so it's, of course, our job to try and raise money in other places where the state is falling short. And I just wanted to also comment on who else will be displaced if our nursing home closes, and it's these angels we call nurses. And there's a lot of families that are riding with those people too.
Okay. All right. No, thank you. I appreciate that. And I hate to have to rush, but I do have other appointments that are sitting outside my door here that I'm starting to run late on. So is there any one last comment? So, but otherwise I've got to get on to my next appointments here.
Just quickly, my name is Tom Henderson. I was the Human Service Director for Brown County for 46 years and retired now to a wife that has Alzheimer's. So for a couple years, and I look at 2 nursing homes closed in the area, 191 people on a waiting list for Oak Hills in the course of last year, 220 referrals to Oak Hills last year from all over the place where they don't have enough help, and a bunch of nursing homes in this area who don't operate at full capacity. They drop 5, 10. We were dropped 12 most of last year because we can't staff them, can't afford. And the pay for these individuals for what they do has got to make the work, it does make the work somewhat more difficult than a lot of other situations. McDonald's, I hate to mention that. But, and then I know the stress in those jobs too, but these jobs are super stressful, and 2 students you saw here, they are remarkable. And if we don't get this help, I was chairman of the board for Oak Hills for a number of years, and I know the financial situation as a community home they're in. They cannot keep going with the funding that's coming through at this time.
Okay, thank you, Tom, for
Representative
sharing.
Fischer, I just want to introduce myself. I'm Candace. I'm the administrator at Oak Hills. And another thing that really needs some regulatory notice on is the temporary staffing agencies. We are losing our nurses that have dedication to our buildings to these temporary agencies because they're getting paid so much more money. There needs to be some regulations regarding that as well, if you could take a look into that.
Thank you for bringing that up. I would not have thought of something like that. And I'm making note of it right now. Thank you for that additional information, Candace. And at this point, I do have to let you go as other folks come in. So
Thank you so
Thank
much.
you.
thank you for your time.
For your time.
Thank you. Yep, bye-bye.
So that's a lot to think about. The next Zoom meeting is going to include at 12:30, the Chair of Health and Human Services, his name is John Huffman. He had 34 people that came from 6 counties in south central Minnesota on the 9th of January get on a bus that was paid for through private donations, and we went up to the Capitol to talk, to actually testify. And Mike Firth was listed to testify. And miscommunication was magnified in my eyes when I got there because we were blindsided. It turned out we had no time for him to present. We sat in that conference room, and Clay Schultz, who happens to be working for the Journal, came along. The article was in the paper the next day. There were people from the Free Press, a reporter. They also came to Oak Hills and watched us get on the bus. They followed us to St. Peter, where we picked up some more. And it was amazing that we went to all this effort, all these eager people. Many of them are in the audience right now, and there was no chance. So then the next thing that we did was to get 2 buses and signed up 71 people that were willing to pay $25 a piece so we could pay for the buses that cost $1,500 to go from here to the Capitol and back. And at the last minute, we got torpedoed again because of communication problems. I think the Congress is just so baffled by all these people who are going and said, me first for my project and everything, that they have no time. That's why this thing, there isn't even a flicker in the news that this is a problem. And you people are aware. And we actually have vets who are 100% disabled at Oak Hills. And actually, Greg Peterson came today because we said, that's part of the money that's coming in. That's more assured than some of the other things. We have somebody who's a member of 100% disabled veteran at Oak Hills. So we know it's right in our skin as to how important this is. So this is one start. So you've seen kind of what happened. And he referred to Chair Knorr. I have called his legislative assistant at least 4 times and left messages, and no one's ever answered me.
They're
Ever.
not taking meetings.
So somebody said they're walling themselves off.
Yeah. Nor is not hearing any input.
I have tried. I'm Sergeant of Arms, Clerk of the House. We know each other really well. Oh, yep, we'll give you the number. They said, keep on going, keep on going. We get there, stonewalled. I leave a message, and most often I think I'm pretty respectful, but towards the end you kind of get scratchy and, get a little bit disagreeable. Hopefully that's not going to happen, or I can control that. But I mean, it's ultra frustrating. And the governor's office, I think, is kind of behaving the same way from what my input has been, because we've tried. And I think he's not aware. He's got to have a soul that understands this. They talk about personal care attendants, and they talk about assisted living. We're talking skilled nursing that's ultra regulated, almost like the nuclear industry. And it's impossible to replace that. Once a skilled nursing home is gone, it's not coming back. It's not. And then where are people going to go? And I see Connie Grahams, because she's been in the legislature quite a bit at the Nursing Association. Yes, Connie. That's okay. Sure.
This one is working right.
Minnesota Nursing Home Association.
Yes.
Okay, so what are they doing to help you? Because I struggle with how poorly this is going once I got involved. I mean, I testified with the Minnesota Nursing Home Association in the late 90s.
Yeah.
I mean, in the early 90s when I worked in long-term care. And they seem to be instrumental in organizing and getting us appointments. And I know from my work at the Minnesota Nurses Association, it's those kinds of bodies that can help you get to the right people and make sure you have appointments with people that know what they're doing. So my kind of quandary over the last month or two has been, where is the Minnesota Nurses Nursing Home Association, and I don't know anything about Leading Edge, which I also
Yeah, so-
apologize for, but they don't seem to be very helpful if you're paying them.
Right. Yeah,
If you're
so-
not paying them, then that's okay, but
Yeah, we are paying them, and we pay dues to Leading
Yeah.
Age Minnesota as well as Leading Age National. And so they are the ones who are working on advocacy for us on our behalf. However, it hasn't been
very successful.
very successful this year for some reason. There's another association in Minnesota called Care Providers. And so they are working together, and they have the long-term care imperative that kind of is an umbrella for the two. And Care Providers has been very, very vocal, and I think they've been having some success. So I don't know how to answer the Leading Age. I know they're working on advocacy for us, but it does seem like there's been some roadblocks.
And so the Minnesota Nursing Home Association, are they helping at all?
I think that the Minnesota Nursing Home Association is Care Providers and
Care
Leading
Providers
Age
now, okay.
Minnesota, yes, and the long-term care.
We were asked directly from Paul Torkelson to make more noise. He called Candace on Monday night and asked us specifically to make more noise, to get these bills some attention.
Well, that's
Somebody's raised their hand back there and said they can't hear.
People back here can hear you from up there. Can you? He's poor. Need the mics on or something?
The mics are on. We just need to get a little closer to them, I think.
Sorry.
Says 6 inches.
ask you to make more noise. Is he going to change his vote? Or is he just going to vote Republican? That's the question. Did you ask him that?
Well, the Democrats are actually the holdup for
Yeah.
us. Is the Republicans are supportive.
Isn't it amazing? It's like a
That's amazing if that's
Flip-flop.
They
really
said-
true.
last
is.
session, they
Yeah.
said they had already approved that they would have $1 billion. That's the information that got to my ears.
Right.
The Republicans were all on board, and the Democrats stonewalled it. So
Right.
what happened on the 4th of January? 25 things got up on their agenda. Look for long-term care, no place.
Right.
No place.
So this $800 million, where did that come from? Is that
Can you
like-
hear me? Okay, okay. So the only thing that I can think of is,
Stay close to the mic.
the only thing that I can think of is, I know the Senate had passed funding last year already, but the House and the governor put a kibosh to it. So I don't know if that's part of the 800 million. That's something that we will need to look into. We were not aware of that. We had never, that has not been brought up at all, so this was news to us. That's the only thing that I can think of, is that was part of the discussion last year that did not pass. That, it's a
that got
possibility.
stonewalled because of
Right.
the election and everything?
Yep.
Nobody
You
would.
wonder when you're going to get the money, because some of these homes, what I've been hearing from all of the rest of the county is that they don't get money, they could close within months.
Yeah.
Can't be in the red forever.
No, you can't be in the red forever.
And that would be horrendous. I mean, think of something like Divine Providence or, St. John's over in Springfield.
Right.
They've had their whole population for decades that have supported that place. They're in many places nonprofit, many are affiliated with churches. And I mean, you erase that kind of goodwill, it's gone.
Well, and it's been too many years of poor funding and poor salaries. And so now you're consequently significantly behind the rest of the industry, so it's really tragic.
It is.
So I don't know either.
And you were in the hospital, acute care hospital.
Well,
They've
yeah, I
got their
understand from
pieces-
the hospital side and the long-term care side, but it is a problem when the beds are full and there is no place to send people, and you can have all the 50-mile from home rules in the world.
Yeah.
But if there's no nursing home 50 miles from home, your loved one, family member has got to go somewhere. I think most people, as I said before, don't even understand the consequences of taking all the people out of Oak Hills and taking them home and figuring out how to care for them.
Right.
Someone has a home to go to.
Well, that's just it. I was saying before, I've been to the mission in Guatemala several times, and because there is no social service in a third world country, the old people just eventually live on the street, and so we have no concept of how that would be in Minnesota, but that's what happens. There aren't programs. And if you lose a family, which they lose them quickly, people are killed all the time in Guatemala or die because they have no resources. These old people just live there waiting for somebody to throw them a scrap of bread on the corner. So I don't think we want that to happen in Minnesota, but people truly aren't vested in what the issue is here. The issue is, and it's not really immigration to staff the beds. I had a hard time keeping my mouth shut about that one because
We're trying everything we can to get people to work.
yeah, I know. But, and you can't get people from Iowa, South Dakota, and Wisconsin. They have the same labor shortage we do,
Right, correct.
you know.
Well, and I think Dora and Joey can, testify to this. A lot of times we're their family. There are so many people
Yes.
that live in our building that do not have other family members. And so we are their family. So it's a perfect example is if we close, they're not going to be able to go to their son or daughters or, wherever because they have no one.
Well, as I said many times, working in the discharge planning world, you could have one child or you could have six. And sometimes one was more valuable than the six, because not all family dynamics
Right.
are such that they really care, for one reason or another, or they are unable to care or moved away,
Absolutely.
so it doesn't really matter. But I applaud you guys for your service.
Just something with that, like the speed at which the physical health of these residents goes down when their mental health decreases, whether that's a kid moving away or anything where their usual family can't come visit them, immediately we see physical decrease in health. Not eating, not sleeping, or other things get worse just from refusing to take care of themselves or letting us assist them because they're struggling with something else. So if we move people, if we take people away from the support system they have, even if that support system is just a local staff that they're used to, then it's going to be devastating in the physical aspect of their health. And I think that we will see it very quickly and see it as far as deaths in many residents once you take away the safety and the comfort they feel with the staffing that they have here.
Oh, yeah, it's their home.
We did have a great call with Representative Zelinska Carr from Detroit Lakes yesterday, who is a former nursing home administrator and knew fully exactly the issue, had no idea, did not mention the $800 million. In fact, mentioned that we need to go to the Capitol tomorrow for a rally because there is no funding in the House budget for us right now, which I believe her because she seems to know what she's talking about. But one thing she did mention was that they are funding millions, hundreds of millions of dollars in homeless encampments. And so we did say that, and she actually mentioned that herself, that you might as well reserve some space in those homeless encampments for our seniors if you're not going to fund nursing homes, because that's where some of these people are going to go. So to your point about Guatemala, she understood that
That's what happens
that's
next.
what will happen.
The other
So
thing,
they should probably have some nurses on staff at the homeless encampments too,
Yeah.
because they're going to need them.
Yeah.
right. The other thing is, what they call bed sores. Those are really not seen in most nursing homes. When I came here in the 1970s, I saw big ones, and they were at home, and it was the spouse that took care of somebody who had a massive stroke, and they weren't just the shallow ones that went through the skin, the fat, the fascia, the muscle, down
I
to the
remember
bone.
those from the 70s.
Awful. And you think that would be a piece of the past, like polio, we got the vaccine. We should never see that again. Well, I'm just astounded that we might.
And there's definitely neglect charges or neglect cases that we see in families that are active and vocal about the care for their different loved ones or spouses because they're trying their best to take care of them. It's not that they don't love them or that they're ignoring them. They're trying so hard, but you can only do so much when you're not trained and you're not in a facility with different lifts and different medications right on hand. It's not that we see these neglects because they're just ignoring their loved ones. It's because they don't have the capabilities to do the skilled care that these people need.
Thank you for that comment. Now, let's speak to that myself. I love my mother, but no matter how much I love my mother, I could not help her recover from 3 different surgeries she's had in the past years, and every time got the best of care at Oak Hills. And like I said, I could be just as devoted and loving as I want, and it wouldn't have mattered. I was not equipped to help care for her in her recovery. And so it's not just necessarily people who are older, and sometimes it's your sons and daughters. Sometimes it's brothers and sisters. And so, yeah, this is,
I think one of the biggest problems is that people don't also understand, even in this community, anybody really who has not had a family need of this nature, that there are not people to hire. I mean, I have an aunt that I've been involved with caring for now for the last few months. She has a single son and, not a lot of support. And, his answer when we brought her home from Abbott Northwestern was, well, we'll hire somebody. I said, that's a great plan, but there's nobody to hire, so I'm going to do her leg ulcers until we can get somebody else to do them, because, that's, people just think they can buy somebody to help.
that's-
Even if you have the money, you got to have a body.
Yeah, and that's just a part of the
Yes.
care. Tom and I were having a conversation before this started about the nutrition. His wife is sick of his cooking. And
Oh, Tom, you
so,
this thing for 47 years?
nutrition, we see so many people coming into our facilities that are so malnutrition because they've been living on their own, they've been, eating,
Right.
whatever it is. And when they come into our facility and they start receiving proper nutrition, they just thrive. So that's a big part that I think we sometimes fail to discuss because, the obvious is the care and the ulcers and the, wounds and things like that. But nutrition is such a huge part.
And as Dorothea said, socialization.
Yes,
And
and
feeling it like
mentals.
it's your home,
Yeah, and I think that like people like PCAs, like someone you could pay to come into your home so that you just have your like small staff, you're not at a facility.
Right.
Even if you can afford to pay a private company, is your home equipped for these people? They can't go up and down stairs. Where is your bathroom? Where is your bedroom? Can they get in your bath? Can they sit on your toilet? There are so many expenses to have your family cared for that's not just at a facility where we already have all of the machinery or even just the little equipment that we use every single day with every single resident.
There are some self-addressed envelopes there. We want to make it easy. So if you feel impassioned about that, we had 2 questions. One is, why did you want to sign up and go on the bus that never got to go on the 13th? And why did you go to all the effort to be sitting here right now and getting in on this Zoom meeting? And you just can write those 2 things. It goes to Obler, who we're going to get a Zoom meeting with at 12:30, and it goes to Obler. So it goes to Obler and Hoffman. So hopefully they can spread that around, because there is a way, it'd be nice if you could all come up to this microphone and I could go. But I
Better
have to let you know.
because we're at the 11th hour with these decisions here
Right, 'cause
in
it's
the
the-
legislature. They're making them each day as we go forward. They plan to close the session on time,
meeting's on time, but they'll close the session on time?
I
Okay.
guess.
Time is
handle
running
it.
out.
It's 1 p.m. According to Representative Zielinskar yesterday, it's 1 p.m. at the Capitol Press Room, and then we will be moving up to the House chambers to rally there after that. So it would be individual vehicles if you want to carpool, people wanted to get together.
I happen to have a bus going up there tomorrow morning.
Really?
Oh,
Awesome.
Not full.
Nice.
The Veterans Bus is going, it's Veterans Day on the Hill.
10?
Take 10.
When will you come back?
awesome.
5, probably.
Be here at 5?
No,
Leave at 5.
When are you leaving?
8,
8. From the courthouse?
courthouse.
Okay.
Bus conductor standing outside. I want your name and your cell phone number.
Right.
Because when we're done, we want to come back. But
Right.
we won't be done till about 3.
Good. All right.
Thank you, Greg.
That's great.
That's wonderful.
That is so helpful.
Folks, I want to thank everyone for coming, and I'm guessing that we just keep preaching to the choir, and if you weren't on board with the issues here, you wouldn't have shown up today, so thank you for the show of support. But is there any questions that any of you still have? I hope you've learned something here today as well. Jody?
I know that we had talked before about the delay in receiving your reimbursement, where the Metro gets theirs sooner. and the outstate does not? Has that been talked about at all?
Yeah, I mean, we've shared that.
The question was has the issue been addressed of metro nursing homes getting their reimbursement from the state, and while outstate Minnesota is still waiting for theirs and does not receive theirs at the same time? That was the question.
20 minutes.
Go ahead,
we-
Candace.
20 months.
Yeah, and we have, we have discussed that with every legislator that we have talked with. Some people are shocked about that. They weren't aware of it. There are some that are educated on it, and I don't. They have no answer
That's
on
not
what they're
new.
doing. Right? No, that's nothing new.
20-minute delay. I mean, 20
20
month
21
delay,
months.
right?
20 months delay. Who
We
keeps-
have a great champion in Representative Zelinsakar. We talked with her extensively about that yesterday, and and I specifically asked her, past this session, we need to keep going with these issues. And she said as long as she's in her position, she will continue to champion those issues. So we will continue to, and Paul Torkelson has been extremely supportive as well. So with those two on our side, we'll continue to push forward.
And Senator Hoffman and
Yeah,
Abler have
and
been
Abler.
great.
Senator Don's called me on a Saturday. We talked for half an hour at 7:30 at night. And, okay, got it, thank you. And I think the question we have to ask at 12:30 is, who else, you people live up in the Minnesota legislature, who else do we have to try to interview? We're not going to waste our time on those who can't think or open their head. But they know who they are, who are sitting on their hands, I'm sure. And I wished, I had thought of asking our last Zoom person, the Representative Fischer, that, because I can't imagine that they don't know. They say, well, don't bother with that one. They won't even, listen to you. They won't meet with you. They won't answer your calls. But here's one, like the Zelinsakar that we talked to yesterday. Those are the kinds of people we, all of us, should try and get to. And we'll try and set up some more Zoom meetings if we can find them. We've got one more scheduled here, April 3rd.
Well, we have one this afternoon at 12:30, and then April 3rd, there is another scheduled at this point here.
It's going to be a Republican, and her name is Karen Housley. Somebody said, some Democrats said, that's our favorite Republican. So I said, well, I don't know what that means, but certainly we're going to talk with her.
She is awesome.
What time is the one on April 30?
Let me look. One moment.
And if we get more, we'll have them go through KNUJ. Brian Filson has been very good in having us talk on community affairs.
April 3rd is at 3 p.m.
Here. And Steve Sherman around the corner there knows about it. And this is going to be recorded, and it'll be going on NewCat. So people who weren't here and wanted to be here because they were coming at 11:30, and we found out just yesterday afternoon that no, it flip-flopped. Now it was 9:30. They'll have that chance. And I suspect the person who's involved in the Journal will put that in as well.
No pressure, Clay.
Anybody else
All
want
right,
to
well,
make?
thank you, everyone.
Thank you for coming.
Thank you. Thank you, Joey. Thank you. That's
Do okay.